Hi, everyone. Thanks for joining me. I'm Tom Ryan with Provider Outreach and Education. I'll be your presenter today. Today, I'm joined by Ashley from my team, and she's going to be your chat host. She's going to monitor the chat, answer any questions you may have or anything put into the chat. Now, I do want to remind you that it is important that you open that chat up if you have it available to you. She's going to give you some links and other items that may be super useful in the future. I will try to speak through all of them or provide any of that in case there's anyone just listening on the phone. Today, we're going to explore not covered items for Medicare. Some people call those never covered items or services. Also, the terminology typically used by CMS is why it's entitled non covered items and services or non covered services. So, a lot going on there. So, what we're going to do this is we're going to help you avoid claims denials regarding never covered items or services. That's the goal. We do have a lot of items submitted to us for these types of services. Again, they are never covered by Medicare. This is different than a not medically necessary service that you may submit for that type of denial. Okay, a never covered or non covered service is something actually excluded by law, and we'll explain that more. I was asked for some resources or lists or other items like that, and we'll talk about those. Then the last area will be to answer your questions related to this topic. I do want to encourage you to put your questions in the chat. Make sure that we have those questions so we can verbally respond. That's what Ashley's going to read out to me. I think it'll be a little bit easier than trying to open all the lines. The first question we're actually going to start with came in on the pre-submitted questions list, which was part of your registration process. And it was, are non-covered services the same as never covered services? And the answer is yes. CMS uses the term non-covered commonly on their website, while providers use never covered. They are not the same as not medically necessary services. And there is a difference, and we'll get into that explanation next. So the first slide we did build in is built in to explain the first section. I'm sorry, not slide. The first section that's built in is to explain the difference between a not covered and a not medically necessary service and how CMS uses those terms. Non covered is, again, another name for not covered or never covered. Okay? The reason that these terminologies are important is that when you contact customer service, you can actually get a different answer by using the wrong terminology, or you're not using it the same way CMS does, which means they answer based on what you're asking, which is correct for the CMS usage, but may not really be correct for what you're asking. So I want you to note that down. How do I know that there's a little bit of confusion over this terminology? Because I looked at the total number of registrants, which again is over 80 people. And then I said, how many people don't have questions or they're just coming for information? Awesome. That's 62% of y'all. Great. Thank you for joining me. Well, listen up. If you do question comes to your head, awesome. Let's put that in chat. But I did then look further and I said, okay, we have 29 people who do have questions. 29. Of those questions, 16 people did not have questions related to non-covered or never covered services. Instead, their questions related to not medically necessary services, which is different. And actually, again, if you ask the question wrong, leads to the wrong answer. It can also lead to us processing your claim incorrectly. So I wanted to make you guys aware of why I'm doing the education in the way that I am doing this education. Okay, so that's why we're going to explain a little bit as we get going here um, about the next couple of slides. So let's take non-covered. Remember, non-covered, and you'll hear me use non-covered, not covered, or never covered. This is a technical denial. Why is it a technical denial? It's a technical denial because under the Medicare fee-for-service benefit package, as defined in the Social Security Act, non-covered, never covered, or not covered are not part of the benefit package. It means that no matter what you do with the diagnosis code, Medicare will not consider this. We're not going to consider this. These services are not something that you are required to bill Medicare unless the patient asks you to. And we'll talk more about that as we get a little bit more into it. Medicare will never pay for these services and will always give you a patient liability for those. We'll talk more about that if you have questions on that. So, what do we look at, and what types of things are examples? And the provide, sorry, the slide does provide some personal comfort items. These are examples. Now, again, what is a personal comfort item? Maybe they're inpatient in a facility and they need a fan, definitely, or they need certain things that are going to make them more comfortable, but not medically necessary. That's what we call a personal comfort item. Most routine services and appliances are not covered. Cosmetic surgery for cosmetic purposes. That's my favorite one to say because if there's a medically necessary reason, we may cover that. One of the examples that we like to use with this one is breast augmentation, a breast implant. It is covered for a breast cancer survivor. It is not covered just for any other purpose. Custodial care, not covered. Ambulance treat no transports, where there isn't a transportation, that's not covered. So just a lot of different things that we go back and forth with. Stop and think for a minute. Are there other services that you know of that Medicare never covers that aren't going to be part of the Medicare benefit package? That's what we're referring to here. Keep in mind, this might be different for Medicare Part C or Part D. Now, Part C is Medicare Advantage plans, and Part D is Medicare prescription drug plans. As a matter of fact, Part B services might be excluded, not covered, ever covered, but they could be something covered under either one of those other two plans. So benefits can vary, which is why we use the terminology traditional, fee for service, Medicare Part A, Medicare Part B, something like that, versus all of Medicare on an overall basis. So hopefully all of that makes sense, ties a lot together, right? Now, the next question that we actually got relates to my next slide. My next slide is built to say it's different than a not medically necessary service. A not medically necessary service is a diagnosis driven service that will not be paid today. In other words, it's not for Fred today under Medicare traditional fee for service. This is different than Medicare never covers it for fee for service, not medically necessary. This is where the confusion fell into, and I can tell that because of the questions I was asked. Okay. So, not medically necessary comes from a local coverage determination or an LCD, a national coverage determination or NCD. It can also come from the internet only manuals. Now, the internet only manuals are the day to day operating instructions for Medicare. What they do is manualize the uh, Code of Federal Regulation and the Social Security Act. So there's a lot of information within them that will help you. Okay. So it's just how do we put it all together? That's why we call them the day to day operating instructions. So keep in mind this webinar, though I will answer the questions that were pre submitted about not medically necessary services, the real goal of it is to look at a non covered service, never covered, or not covered, however you want to say that. We will not really focus on not medically necessary. Okay. Now, one of the questions that came in focuses on informed decisions. One of the things to keep in mind about an informed decision, that is a great question, and I want to bring that up, is that Medicare informs a patient when a service is not covered, never covered, or non covered, The provider informs the patient for a not medically necessary service. Okay, there's a big difference there. Can a provider inform the patient of a not covered, never covered, non covered, whichever that terminology you choose to use? And the answer is sure they can. They're not required to. So that makes a big difference when you think about it from that perspective. If it is a not medically necessary service because it's not for the patient today, based on diagnosis, based on a frequency limitation, based on a technical denial, meaning it didn't meet a certain criteria for Medicare, those are all things that you do want to inform the patient of. However, Medicare tells the patient a lot, and so we want to make sure that we're using which section and whether or not an ABN is mandatory or optional. And an ABN is an advanced beneficiary notice of non-coverage. So there's a lot going on with those two. On this slide, you're going to see a link to the Medicare and You Handbook, which is the first link. And then you'll see on the very bottom of the slide is the FFS ABN. FFS stands for Fee for Service. ABN, ABN is the Advance Beneficiary Notice of Non-Coverage, or the form that CMS requires for not medically necessary services, but can optionally be used for never covered services. Now, the reason that I'm emphasizing that and putting that into play is I had a lot of questions submitted. So I'm answering some questions without actually reading fully all the different questions. So hopefully that helps you. Let's take a look at the Medicare New Handbook and then the ABN page. Then we will move on in our slide deck so that I can get you through the start of some of these resources. Okay. So let's jump over to the website. And Ashley, can you verify for me that you are seeing Medicare.gov, which is the CMS website for patients?
Yes, I can see Medicare.gov.
Perfect. Now, here's what I want you guys to be aware of with Medicare.gov. While providers typically use CMS.gov, that's the provider website, Medicare.gov is written at a different level and a different perspective. Medicare.gov is the patient website. Why do I bring you to a patient website when you are part of our provider community? And my answer to you is because I really do want you to see the Medicare and You Handbook right here in the front. Now, when we come into this page, Medicare.gov, it looks like this. Welcome to Medicare, getting started with Medicare. I think the easiest way to find the handbook is to move to the top, select the word basics, go to the right column and just say Medicare and You. Couple of things to keep in mind with this handbook. It is sent to each patient annually, unless the patient opts to have it sent to a household. So let's say that there's a husband and a wife who are both on Medicare and they don't both want the handbook. They only want one sent to their household. They can do that. That's the patient's option, but both of them are still required to know the information. If you want to know more about this, you can actually scroll down and simply download the PDF. They'll give you paper copies if you want it. I do like downloading the PDF. What this does is just explains all of the different benefits and what a patient might need to know. I do like going to the table of contents, which again, this is where you're just going to find out different things. Also, if you scroll, and I'm just going to scroll through all the pages, and I go to the last few pages, there's a bit, oops, sorry, I'm not on the last few pages. There we go. There's just a bit more information for looking for other languages and items that will help a patient should they need it. So I think that that's important to understand because not all of our patients speak English. So how do we get them what they need? And this talks about the accessible communications and other items. So if you're looking for any of this information, it is a great opportunity to look through. If I go back to the top, I can also use my index of topics. Again, this book does tell patients what is never covered. And because this book informs them of that, you do not need to re-inform them. Doesn't mean you can't, it just means you don't need to. And there's a big difference there. Okay. So that's never covered versus not covered. And the other thing that I did mention is on the CMS.gov website, because it's for you to inform a patient of either a never covered or a not medically necessary service. And that's the ABN, or the Advanced Beneficiary Notice of Non-Coverage, ABN. So we're going to move to a website called CMS.gov. This is probably the one you're more familiar with. Now you can simply search ABN, you can search BNI, Beneficiary Notice Initiative, up here, or you can come here and navigate to it. And I'm just going to scroll down. And here is Medicare. It's the term on the left side under cms.gov. Come to Forms and Notices, and you can see on the right side in the column Beneficiary Notice Initiative. And there we go. CMS fee-for-service ABN. Scroll down and there's more information on this page regarding the ABN. So a lot of different things to go on there, and we'll get more into the ABN as we get going a little bit here, but I wanted you to at least see them. Okay. So this is how you're going to inform someone that the service is not medically necessary or never covered. Okay. And again, it does have a variety of different factors. All right, let's jump back to the PowerPoint for just a moment here. Nope. Sorry, it didn't open. There we go. So let's go through some different resources, because this is one of the biggest questions we also had. What resources do I have available to me to help? So let's answer that today. And let's get through some of the different resources and the items that might help you get through all of the different areas within it. And I really do want you guys to have that opportunity, okay? So the first place we always recommend and that you need to be aware of is the federal law, because this is the items and services covered underneath that. And which section do we want to look at, okay? Now, I will first search for two different areas. One, 1861 gives a lot of coverage exclusions, or tells us about the benefit packages. This is the area that does not require an ABN, versus 1862, which could require an ABN, especially if it's falling under medical necessity. Now, 1862 also has exceptions that are never ever covered, like there's no legal obligation to pay for this service, or it's paid for by another federal entity, such as the VA, the Veterans Administration. So there's some different items definitely within here: routine eye care, routine dental. And the reason they use the word routine and routine foot care is because if it's medically necessary foot care or medically necessary eye care, then it is going to be covered, and we're not going to have the ABN. So that's what we're looking at when we look at some of this different information. Now, somebody said, what's the easiest way to find this? Here's how I like to do it, and this is just me. You can navigate. You can save this. You can do whatever you want to do there. Here's what I find as my easiest way. Go back to the top up here, move to a new tab. I'm just going to pick one, and I'm going to Google search. So you can do that by simply placing the item directly in the tab. Now, if you say I don't use Google, I use a different search engine, that's fine. Just the one that I happen to pick. The first item comes up with socialsecurity.gov. This is the official website, so you can select that and you can read all the information in 1861. Okay. So there's a lot of information in here that defines for you when items and services are covered. That's the whole point of the administration. If you want to look up 1862, just change that to 1862. And again, you can look up a lot of information, okay, by simply looking at this information. The difference is right here in the top. Notwithstanding any other provision, no payment may be made under Part A or B for expenses incurred for items or services. And if you continue with A, then we go 1A. This is where we look at not reasonable and necessary, which means not medically necessary. But if we continue, there are other things which are statutorily excluded, and that's where the list on the slide comes into play. Okay. So just a lot of information to go with there. Now, Is this a complete list of everything? No, unfortunately, it's not a complete list, and it's not done that way by CMS. There's no complete list saying this procedure code and this procedure code. Please don't confuse this. If you are a Medicare physician fee schedule biller, okay, again, Medicare physician fee schedule biller, there is a list of codes that'll come out and they'll say, no, this is statutorily excluded. It's not saying it's statutorily excluded all the time. What it's saying is that list, the Medicare physician fee schedule, excludes it. So for instance, an ambulance code or a lab code are provided on there saying they're statutorily excluded. Well, they are, because they're not on that list. This is different. And I wanted to make sure we pointed that out without really getting too in depth into it. So remember, just because something says statutorily excluded doesn't mean it's never paid. It might simply mean that it's not part of what you're looking at today. And my example of there is it's not part of the physician fee schedule, but it could be under the ambulance fee schedule, the lab fee schedule. It could be part of an inpatient payment, such as the IPPS, Inpatient Prospective Payment System, or OPPS, Outpatient Prospective Payment System, Critical Access Hospital, all of those different things. So hopefully that helps you out a little bit. I was asked for a list of or some information on common not covered services. That's where you can start here, but let me give you one more resource that might help you in case you're ever looking for it. Come out to the manuals. Okay. And these are actually going to be, let me finish with this one. It's going to be on the Code of Federal, it's also going to be on slide 10. So we'll get to slide this, and I apologize for jumping ahead there. We'll go ahead and deal with that in just a second. On the other hand, let's start with slide 9, which is the next slide. What are we looking at on slide 9? We're looking at the Code of Federal Regulations. What that is the interpretation of the Social Security Act. So how CMS is going to implement the federal law is defined for you in the Code of Federal Regulations. This is a very important resource. I do recommend that if you're looking up the Code of Federal Regulations, you take a look at this information. Now, again, we can Google search the information by typing in 42 CFR Part 411. Giving this to you on the reference on the slide. Now, what that stands for is it's the Code of Federal Regulations, Title 42, Chapter 4, Subchapter B, Part 411. Did you get all of that? Now, I personally am like, well, that's too much for me. I just remember the little bit that I need to. Here's where you're going to see the exclusions from Medicare list, which is really a nice list. Again, I just typed 42 CFR Part 411, just a quick hit tip. When I open it up, I can read through the entire exclusions list. Okay, and it just defines a lot of information. It gives you other sections you can look at in the Social Security Act. It gives you things within the scope of practice. Now, again, these are not going to fall under medical necessity denials. They fall under non-covered denials, or not medically, not part of the Medicare program benefit. That's what the court, this whole section is about. That's why they're called exclusions. So when we look at it, it defines for you a lot more information. So as I said, CMS does take the Social Security Act. Then they say, hey, this is what we're going to do with it. And that's what the Code of Federal Regulations does. And then they give us day-to-day operating instructions. And that's what the manuals do. So if you want to look at a manual that will help you with this, please go to cms.gov. Now, the day-to-day operating instructions are within the manuals area. So we go Medicare, because that's the program we're talking about, Medicare. Underneath that, regulations and guidance. You're going to get guidance on the manuals, on the Code of Federal Regulation. So guidance on the manuals. Okay, so we're going to select manuals on the right side. It's kind of the middle column. Once we open up the manuals tab, the first item on the left side is called Internet Only Manuals. That's where all the manuals are located. Let's go ahead and open that up. What we're looking for is a manual called the Benefit Policy Manual. Again, this is just your general coverage, and it's why it's really important. This manual is 100-02. And then you get lots of information about what's covered, when it's covered, why it's covered. But if we scroll down and then look away if you don't like a fast scroll, I'm going to apologize right away for that. You want to come to chapter 16. What's important about chapter 16 is it does provide you a list of generally excluded services. These are not related to medical necessity. They are exclusions. When you open this, you can read all about the exclusions and the items that are here for you. Now, again, is it going to provide you a CPT code or a HCPCS code, a procedure code list? The answer is no. Instead, it's a lot of verbiage about it. So hopefully that makes sense in how we got where we got. Okay. Another resource, and this one comes from a question that was posed to me, is are you required to submit a never covered, non-covered, or statutorily excluded service? The answer to that is no, with one caveat. What if the patient needs you to submit it? What if the patient tells you to submit it? Then yes, you do need to do that. So it's very interesting when we look at this one, because the technical answer is no, but then we go on to say, wait, but the patient might. Okay. So WPS has written an article to help you understand this. This is guidance coming from your Medicare administrative contractor if you are in jurisdiction 5 or jurisdiction 8. If you are not, go to your Medicare administrative contractor and look for guidance coming from them. Any guidance given by us is on our website, wpsgha.com. So if you've determined that a service is never covered, not covered, or non-covered, whatever the terminology is by Medicare, what do you do? Well, you can consider not even filing. Why? Did CMS already tell the patient? Yes, they did. So now what do? Well, you have to listen to your patient. The patient may say, I need that filed, or I have secondary insurance. I have another insurance and I need that. So then you do have to file, right? So a little bit more about this. Look at the article and you can search for any article you want. I call it mandatory, whatever you want to do. But let me show you the steps to find this one. If we go open one of the Part B sections, okay, the Part B sections are the 1500 billing areas or the 837P billing areas, you can go to the topic center, go to claims, which is on the far left column when you open that drop down. I don't like to search through this. What I typically do is use the filter right here, and you can see me doing that. And I filter for the term mandatory. And you can see under claim submission, there is an article and it comes up and says mandatory claim submission. It just tells you a little bit about the information that you need and do you have to or not have to submit. Okay. This is the exception that we're talking about. And that's where we want to make sure everyone is aware of it. Now, again, this is for the Part B side. The Part A side, though, the exception does still apply. If the patient says, hey, I need you to file that claim, you get to file it, right? We'll talk more about some of the different things that go on the claim in just a few moments. So remember, anything labeled Part B right here on the top or up here is for 1500 and 837P billers. This is a CMS defined Part B contract, not a benefit category. CMS defined Part B contract. Part A is the CMS defined Part A contract, which is billed on a UB04 or 837I. So we'll get more into that as we get a little bit through some more information here. Okay. Get through these slides and caught back up again. So we looked at the Social Security Administration. We did look at the Code of Federal Regulations. We looked at the manuals. We talked about this article. So what's next? Well, what's next is that understanding of whether you need to inform the patient or whether Medicare will inform the patient or whether it's already been informed. Okay, and I'll explain all of those different items. So first, informing the patient, which is a very commonly asked question, is done with the Beneficiary Notice Initiative and the Advanced Beneficiary Notice of Non-Coverage. It is an optional use when it is a never covered item, which means you do not complete the entire form. You do complete the top of the form down through the cost estimate. The patient does not need to select an option. So that's important for everyone to understand when we look at the ABN, right? The Beneficiary Notice Initiative. Lots more to come on that. We're going to take a bit more information on the next couple of slides to get through that. Okay. I'm going to stop here for a second and we're going to go through this slide next. But Ashley, have we had any questions sent in the chat?
We've just had one question come in, and this one asks, is there a way to submit a never covered service by a CA on a type of bill 85X so that there is a denial to send to the member's state Medicaid coverage or a secondary plan that is not a supplement but will cover the service? An example would be preventive services. Claims get RTP'd and we haven't been able to find a way to get processed as a denial.
There is a way to do it. We'll talk about that in just a few moments. So literally, it's a few slides down from here. So give me a little bit to get through that. If after slide 17, possibly moving to 18, you still have a question, hopefully that will be answered to you. Give me a little bit more to get to that one. Anything else?
That was it.
Okay, perfect. What I'd like to do is jump back to the CMS website for just a moment. And the reason I'm going to do this is we do want to look at that BNI section. We want to look at the forms and notices area. So here we've got the list, and we'll scroll back. As I said at the top, you can search for Beneficiary Notice Initiative, or you can search for ABN. Let me teach you how to navigate should you want to do that. Use cms.gov, use the term Medicare, scroll down. Way down here, you got forms and notices. And again, you've got the CMS forms, the forms list, and the Beneficiary Notice Initiative. Use the bottom one here, the Beneficiary Notice Initiative, which is BNI. On this one, you can go to the left side to the fee-for-service ABN, or you can simply read through all the announcements and scroll down. Here we go. Here's the chart, the list. What's great about this chart or this list is that it has a couple of different links you could use. And you'll notice there's links to notices. It's got a directions link. I love this PDF. It just kind of explains everything you need to know. But then the one above it is the one that will actually unzip and give you the form. Okay. And so, as I said, when you look at the form, the important section is to remember you do have to do the top part of the form, not the full form. Okay. So hopefully that makes sense. And it's just a way to get you where you need to be. Now, again, it's super easy to grab this, use it, don't use it. It's up to you unless the patient asks you. Let me move forward with this one. I was asked for a reference as to why someone doesn't need to use this form for a never covered or a non-covered service. So I built that into the bottom of the slide, and you'll see that down here. Down here. Now at the bottom, I don't know what I put the slash in there for, but apparently I have a typo. It's Medicare Claims Processing Manual, Chapter 30, Section 50.2.1. Wow, that's a lot. So if what you want to do is just simply open the link, awesome, you can do that. Here's the other thing you can do, and I'll take you out there in just a moment, is go out to the cms.gov website. I'm going to scroll back up to the top because we're going to go back to that IOM. When we do that, we open Medicare, we open regulations and guidance and manuals. We open the internet only manuals right here. Now this one's a little different because it's in the Medicare Claims Processing Manual, which is 100-04. We're going to scroll down, open up that manual. Now look away because this has a lot of manuals within it and it's way down on the bottom. It's chapter 30. So just look away if you don't like the fast scroll. Okay, I'm done with the fast scroll. But what you're looking for is the financial liabilities protection. And that's where you're going to get to scroll through and find all about the ABN. So this is what you're looking for down here, and you'll see section 50 is all about that. 50.2.1 is for optional use, and that's what we're defining this under and why we do want to use that in that manner. Hopefully all of that makes sense. And there's no questions on that, but we will if there are. If there are, put them in the chat for me, please. All right. Again, lots of information given. A couple other questions that we got right away that I built into the slides. How do I indicate to Medicare that a service was provided as non-covered? And we know that. Well, there are 3 different indications, and it depends on how you bill us. Okay, the first 2 can be billed on either a 1500 claim form or a CMS 1450, also known as a UB04. They could also be billed on either one of the electronic versions, which is the 837P or the 837I, it doesn't matter. On the 837I, they're line item bills, and that's important to make sense. Then the second one, we'll talk about it in just a moment. The first one says, hey, this is non-covered. I understand that. It's not covered. It's never covered, whatever you want to say. For this line item on the UB04, the 837Is, or same thing on the 1500. What it also then indicates is that you gave an ABN and it's validly completed. Remember, it has to be through the first notification area, comes down to the cost. The rest of it, the patient doesn't have to pick an option. They don't have to sign it, but it is validly completed. When you give this ABN, it is a nicety. Doesn't mean that you don't have to explain it. It doesn't mean anything like that. On the other hand, if you say, didn't give an ABN, didn't even want to do that, I'm just going to rely on what Medicare already told the patient in their Medicare and You handbook, then you bill the GY modifier. Okay? You bill the GY modifier. Now, if you are a UB04 biller or an 837I biller, and everything on that claim is non-covered or never covered, and you did give an ABN, okay, then you can bill with occurrence code 32, but you do need to include the date that you gave the ABN. You do need to include the date. So what we're looking for here is that whatever's going on, it's not covered, never covered. So hopefully all of that makes sense as you get into the billing sections. So we got through all the information that I have to give you, except we didn't get through all the registration questions, which is the next section. What we'll do is answer those questions, then we'll move on to the chat questions. So now's a great time to put your question into the chat should you have one. So hopefully I'm not breaking up too bad and we're okay to move on to the registration questions. I'm going to stop using the website and stop using the movement around. Sometimes that's what actually causes me to break up a little bit. The first question that has not been answered from the pre-submitted questions is when to bill the patient and when not to bill the patient for a non-covered service. From a Medicare perspective, a not covered, non-covered, or never care covered service is always billed to the patient unless they have a supplemental Medicare coverage that may cover it. Now, you may need to bill on behalf of the patient to that supplemental coverage, but that's not relating to Medicare. That bill should automatically be given to the patient and will be assigned a patient liability by Medicare. So in terms of Medicare verbiage, you'll hear us say, hey, I always bill that. Well, that doesn't mean you should exclude or ignore a secondary form. This would include Medicaid, You may need to bill Medicare saying, hey, this is a never covered item simply to get Medicaid to give you a denial or a payment. Hopefully that makes sense to everyone. The next question that we got is the GY modifier on the new 2026 audiology codes. Is it a requirement anytime one of these codes are billed? Or is the GY modifier more specific if we know the Medicare coverage database or another payer is on file? Want to make sure our billing department is aware of any modifiers required for non-covered services. So if the new audiology codes are never covered, then yes, the GY modifier is the appropriate modifier. This does not necessarily affect the Medicare coverage database. That would be the GA or GZ if you forgot to give it. Please remember that if you did give an ABN, then you wouldn't bill the GY, you would bill the GX. We were specifically asked for a list on the WPS website of covered diagnoses. If you're talking about a covered diagnosis, we do not have that for non-covered services. That is related to not medically necessary services and is not something that we're here to talk about today. The WPS website does list a not medically necessary diagnosis code list or procedure codes in its coding and billing articles, which is available on our website. So keep in mind that's going to be a GA because you gave an ABN to tell the patient, or a GZ because you didn't give an ABN and you should have. However, that is not considered a not covered, non-covered, or never covered service. Next question. Currently, our practice does not have to obtain a prior authorization. However, I want to be prepared in the event we are required to obtain prior authorizations. I work primarily with obtaining prior authorizations for all insurances. If it is a non-covered service for Medicare, you will never need a prior authorization. The reason for that is it's not part of the Medicare benefit package as defined in the law. So prior authorization is not something you would have to get in this case. Next question. If a Medicare beneficiary is receiving a service that is a covered service, but is being done because of a non-covered diagnosis, are we still able to get an ABN and bill them? For example, TMS treatment is only currently approved for severe diagnosis disorder. The FDA has approved for OCD treatment, but Medicare does not currently cover for this diagnosis. Would it be appropriate to give an ABN in this instance? The answer is yes, because this is a sometimes covered service. In other words, it's for Fred today based on the diagnosis. This is not a never covered or not covered service. So you want to make sure that you are giving the ABN should it not fall within that criteria, which again would then be billed with a GA modifier or a GZ modifier. Next question. If a service is as known to be non-covered, either not having a covered diagnosis or due to violations of the Medicare unlikely edits, how are they reported on the claim? Keep in mind, these are not services that Medicare uses not medically necessary or non-covered for. So this is not something that typically you would, this is not something that you would apply a GA, try this again. It's not something you would apply a GY or a GX or occurrence code 32. Now, on occurrence code 32, on the ABN, you would say this is not medically necessary. This is above the quantity bill, which means you could apply a GA. It also means you may have to apply for an appeal if you have a denial. So lots going on with that one, but it's not part of a non-covered or never covered service. The next one, it was very interesting and very hard to answer. Are transports from a patient's residence to a hospice house covered? If the patient has not yet elected hospice, the hospice would not be responsible for the patient signed onto hospice. We bill hospice with an E modifier, so RE is not covered. Are we using the correct modifier for the hospice facility? If hospice is within the hospital, should we be using RH? Stop. Ask yourself, is this transport medically necessary? And is this a covered destination for Medicare? Now, a hospital is a covered destination. Is the reason that the patient is going there medically necessary? Is it medically necessary to transport them to hospice, which indicates that the service at the end result is absolutely not medically necessary? As a matter of fact, hospice is comfort care. So we have a lot going on there. During this transport, you must also ask yourself, what service is required by the emergency medical technician under their medical license by the state in order to make this a payable medical service? So again, lots going on. If you can't answer those types of questions, then the correct billing is to actually bill with either the RE, their residence, to a facility, which could be the E, or the RH if they're going to the hospital, but also to indicate the GY modifier, because this falls under Section 1861S7 of the Social Security Act, not medical necessity portions. So I hopefully got that in there as best I could and gave you all the details you needed. Next question. Is there a place where providers can go to submit when they believe non-covered services should be covered to have them looked at for future changes to policy? So I'm going to answer this in a variety of different effects. One, if it is truly a non-covered, never covered service, you have to go to Congress, and Congress has to change the law to allow for this to be done. If it is not medically necessary and is being done based on something within the internet only manual, those instructions, then that goes to CMS. If it's not medically necessary based on a policy, can you tell me if it is a national coverage determination, which goes to CMS for reconsideration, or a local coverage determination, which comes to WPS? So much to analyze there, and you have to make sure you're hitting the right area. So please remember the next question is again going to be that kind of caveat and goes with what I just answered. When a service falls into a gray area between a statutory exclusion and a specific lack of medical necessity, such as under the Botox LCD, where a therapeutic injection might also cross into a cosmetic outcome or exceed standard diagnosis parameters. What documentation standards determine whether WPS classifies the denial as statutorily exclusion, no avian required, or medical necessity, mandatory avian required? Which modifiers do you use? So, based on this information, how are you putting a diagnosis code on the claim? And that will tell you which one to use. If the diagnosis code does not fall within the Botox LCD, okay, then it's probably going to fall under the GY, don't need to, or a GZ, GA or GZ. That's correct. Again, what we're looking at is if you're unsure, always give the ABN, have them complete it completely. Why do we say that? Because if you're unsure, there's probably what you would like to call the gray area. And our advice is always default to giving the ABN, always default. Next question, how to bill for an IUD being used for bleeding and not contraception? We can't tell you how to bill, and that becomes one of the hardest parts. Determine your code. Determine whether that is the correct procedure code and diagnosis code. Then put it together. Okay. Does the diagnosis code get covered under Medicare? Do you have a reason to believe it will not be covered? And how is Medicare denying that? That will drive much information that you'll need. Okay. How to check if a service is never covered. That's some of the resources that we use during this webinar, and I gave you a variety of different areas on how to check that. Next question. Where can I find medical necessity diagnosis codes? They are available on the CMS website. They're in the Medicare coverage area in the determination process, and it's lab NCDs that'll have those diagnosis codes. But remember, this is a medical necessity denial and not something that is not medically necessary. Okay, so you want to make sure you're following that area. What I can do for you is just paste the link to the website that I found, or that's going to give you what you need directly into the chat here for you. All right. Next, to determine how to easily identify if a claim denied due to non-covered services, is it based on a policy or is it based on the benefit package? This will always be based on a benefit package. The liability will be assigned to the patient. Check your remittance advice and tell me how that liability is assigned. If you just want to better understand, that's great. Remember though, the question that was asked of me is better understanding of non-covered and also a better understanding of not medically necessary services. Hopefully I did a good job of explaining the difference and making sure you're understanding those. There was a question about inpatient non-covered services, and that's literally the whole thing I got. I'm not sure what you really wanted. Let me give you some common reasons for an inpatient non-covered service. One, it's not medically necessary for an acute condition. That would make it non-covered. Two, it's custodial care, like helping them with bathing and dressing and things like that at a skilled nursing facility. It's their daily life activities. It's not a medical necessity thing. Three, it's outpatient observation care. Now, that sounds very weird because observation care is covered, but it is not covered under the inpatient benefits. It is a Part B outpatient benefit. So that's why it's excluded or not covered. Someone asked us about experimental services for inpatient. Medicare does not cover experimental services. And so therefore the inpatient admission as related to that experimental service is also not covered. Hopefully I got enough information there for you. If it is a statutorily excluded service, such as cosmetic, maybe something like that, then the inpatient is not covered as it relates to that statutorily excluded service. So I'm not really sure what you're asking me more than that. If you do have some more questions, put it into the chat. All right. We were asked about telehealth allowed services. Again, a telehealth allowed service is something that Medicare will cover, but there's a list out there. Please make sure that you follow the telehealth list, and Ashley put the link in the chat. I really do recommend you go ahead and grab that. Otherwise, you can go to the CMS website and you put list of telehealth services. It'll bring it right up for you. The next one is actually CPT code 81479. You asked about this code and the scoring, which continues to be denied as non-covered. Now, when we look at that, we do have a policy on this, which to me would indicate that it's not a non-covered. On the other hand, it is a not medically necessary denial. So if you feel the policy is wrong, then you do have to ask for a policy review. If you feel the claim denial should be covered as reasonable and necessary, then you have to do an appeal. So I'm not sure what's happening within your denial, and I'm not sure what should be given. I will tell you, you do want to give an ABN. You have now a reason to believe that Medicare won't cover this based on denials given in the past, and it's not medically necessary based on the diagnosis code. So hopefully that helps you a little bit. The next question is a refresher on non-covered services like the Tdap screening. So that's going to make it into a very important part. This type of information is for a vaccine. Keep that in mind. This vaccine can be used for medically necessary purposes, or it can be given as a routine vaccine. When given as a routine vaccine, it is non-covered for Medicare Part B. However, it is covered for Medicare Part D. So this is where you want to make sure that you're looking at the Medicare Part D vaccines fact sheet to meet all those requirements. For Part D, you have to have a medically necessary reason. What comes to mind is a puncture wound and you're trying to avoid like lockjaw or whatever. That would make it medically necessary. So it's very much a diagnosis driven. So make sure you're following the Part D fact sheet for whether or not you need to bill them or whether or not you should be billing Part D. Don't just automatically assume this is a non-covered benefit, period. That's not what Medicare is saying in this case. All right, I reached the point where we have chat questions. So let's take a couple of those and then we'll go ahead and do closing comments. Ashley, anything in the chat?
We did get a few questions in the chat. One question asked if you could repeat the Botox with regards to modifiers that you were breaking up a little bit at that time.
Okay, so Botox in regards to modifiers. Botox is a covered service. So therefore, you're going to want to put the modifier GA on there or GZ. Sorry, had a moment there. GZ just simply means, oops, I forgot to give the ABN. The modifier GA indicates that you gave the ABN because it wasn't medically necessary today. That's what happens with Botox. How do you know if it's medically necessary? Go back to that policy and follow within that question. Now, that's where some of the people say, well, it's statutorily excluded. If you append a GY or a GX onto there, we will say it does meet a statutory exclusion. That would be something saying, hey, it's just cosmetic in nature. There's no real reason to do it. That will cause an automatic denial. It does not mean that the patient doesn't get the appeal rights. So you need to look at what you're using it for. Are you using it for medical necessity? It just doesn't meet the criteria today, which could be like a frequency limitation or something like that. Or are you using it because it's purely cosmetic? So I know that's a bit long explanation, but hopefully covers what you needed to know. Next question.
All right, the next question is, for claims denied by Medicare as non-covered services, should we still pursue an appeal? If so, what grounds or supporting documentation could justify payment upon review?
So first, if you're telling Medicare that it is a non-covered or never covered service and you are billing that with a modifier or you're billing it to get a patient denial, no, you as a provider should not pursue an appeal. On the other hand, the patient might, in which case we may request records from you. And yes, you do need to respond with those records. But because it's non-covered or never covered, in your opinion, even billing with a GY modifier, you should not appeal it. If you disagree and you think, oh man, this should not be what I needed, then you need to rebill it or correct the billing depending on the situation and how you bill and remove the GY modifier or the condition code 32. So go ahead.
All right, that was our last. Oh, hang on a sec. Oh, we just had one more come in. I'm so sorry. This one says, sorry, circling back to the 81479 question. Medicare is denying with the remit CO96 for a non-covered service. So should we ask for a policy review or do an appeal on the claim?
So the CO96 is a contractual obligation. If you want to know the best way to look at that one up, and I'm just going to give you a tool and then I'll give you the full answer, but let me just show you a tool that might help you. So under tools here on our website, so you're at wpsgha.com, go to tools. On here, you can do all tools. There we go. And then scroll down and you're going to look for this reason and remark code. And then you can say, I want the reason and the remarks code, and you're just going to put 96. Now, don't put CO because that stands for contractual obligation. That's not what we're really looking for here. What we know is, okay, this is a non-covered charge. Refer to the 837 for loop. What I want you to do when you get this contractual obligation 96, two things. One, if it's not processing as a patient responsibility, and you should have it processing that way, that's okay. Then you do an appeal, and what you're actually appealing with that is the liability, the CO versus the PR. You're not saying, hey, it should be covered. That's not what you're doing. If it is something that you feel is medically necessary, then you can do an appeal for medical necessity. So hopefully that answers the question. But it's really going to be dependent on what you write on the appeal for that. So actually repeat that back to me one more time.
Well, you cut out a little bit there, Tom. Did you say you want me to repeat that back to you?
Yeah, that's why I saw something happen with my computer. I was like, okay, repeat it back to me.
Yeah. They said that Medicare is denying with remit CO96 for non-covered service. So should they ask for a policy review or do an appeal?
All right, so CO96, not related to a policy. CO96 is related to a non-coverage. That's what I was trying to show out here on this tool. So the CO96 um, is not something where we're going to have a policy to review. Okay. Now, go ahead and ask us to look at it again. If you feel it's been necessary or you feel it does meet the criteria, denying it wrong, that's fine. You can also ask us to review whether or not it's a contractual obligation or patient responsibility. That's all up to you. It's not necessarily about, hey, I'm looking at this policy and I want you to review the policy. That's what the CO is saying. That's what I'm sorry, the 96 is saying, not the CO. The CO is simply whether or not you want to write it off or whether or not you want to bill the patient. So hopefully I got that answered correctly. And that is going to take me a few minutes over, and I apologize. We're going to go ahead and finish up. If you have further questions, I'll give you a way to send those in to me in a little while. So you're going to have the opportunity to take a survey. Please let us know about how we did. If you see the white box pop up at the end, not spam, not malware, nothing like that. What we're trying to do is just take you to our survey. Will happen after the webinar. Another way to do that is to use the link Ashley just put in chat. Third way, we're going to send you a follow-up email. In the follow-up email, there'll be a link to the survey. And the fourth way is if you listen to this as an encore, you'll have this in the online survey. Please take that survey, give us whatever feedback you have. I want to remind everybody that CMS does have a National Provider Compliance Conference coming up. You can be added to the wait list. However, the full registration has closed at this point. This is an in-person conference, and the actual registration or wait list will close on July 23rd. If you're doing an overpayment, the easiest way for you to do that is with our SecureNet Access portal on our website. You probably saw a section called Login on the top, and that's the easiest way. However, we do have an issue going on where people using the overpayment form are not completing it correctly, and that's the top 3 fields. So if you're doing that, please make sure that you look at the top 3 fields, which are your jurisdiction, contract, or contractor, what that's called, your Medicare type, which is how you bill, Part A or Part B. So Medicare type is actually defined by CMS. Remember, Part A was the UBO for the 837Is, and Part B was the 1500 or 837Ps. And then make sure that you enter the state correctly. Where are you billing from? Whew, that was a lot of information. Um, so just bringing us to an end. Thanks for attending. We really appreciate you. If you do have questions for the next 7 days, drop me an email. The email, again, was put into the chat by Ashley, but the email is wps.bha.education@wpsic.com. Include non-covered services in the subject line, maybe determining not covered services. However you want to say, just something about not covered or non-covered within that subject line. That'll then prompt it to come to myself and Ashley. So thanks for attending, everybody. Thanks for listening. I hope you have a great day and you got some useful information. Have a great day, everyone. You can now disconnect.